Good morning, everyone. I'm Dr. Ekta, AP Pathology. We are going to cover new topic, female genital tract. First of all, we'll be covering cervix. Cervix is a sentinel for potentially serious upper genital tract infection and target for viruses, leading to invasive carcinoma. Cervical carcinoma is the second most common cancer in women worldwide. So the pathologies of cervix are first are inflammatory conditions. Inflammation of cervix is cervicitis. So inflammation could be acute and chronic. Acute and chronic cervicitis. At the onset of menarche, the production of estrogens by the ovary is stimulated, leading to maturation of cervical and vaginal squamous mucosa and formation of intracellular glycogen vacuoles in the squamous cells. So, maturation of the cervix and vaginal squamous mucosa is by estrogen at the onset of menarche. As these squamous cells are shed, the glycogen provides a substrate for endogenous vaginal aerobes and anaerobes, including Streptococcus, Enterococci, E. coli, and Staphylococcus, which will lead to infection, leading to cervicitis. But to counter this, we have lactobacilli in the normal vaginal and cervical flora. So, how lactobacilli help in prevention of infection of cervix? Lactobacilli, it produces lactic acid that maintains the vaginal pH below 4.5 by suppressing the growth of other saprophytic and pathogenic organisms. Secondly, it produces bacteriotoxic hydrogen peroxide. So, lactobacilli helps in prevention of cervicitis or inflammation or infection by maintaining the vaginal pH below 4.5 by producing lactic acid and hydrogen peroxide. When the pH is more alkaline due to bleeding, sexual intercourse, or due to antibiotic treatment, lactobacilli decreases the production of hydrogen peroxide, leading to overgrowth of other microorganisms, which result in cervicitis or vaginitis. So, lactobacilli is a savior to cervicitis or vaginitis. Marked cervical inflammation produces reparative and reactive changes of the epithelium. As you all know, inflammation will lead to either reactive changes or metaplasias and dysplasias, and shedding of these atypical appearing squamous cells may cause a non-specific abnormal Pap test result. So, Pap test is an important diagnostic test in recognition of these atypical squamous cells. So coming to the premalignant and malignant neoplasms of cervix. Here HPV, human papilloma virus, is an important causative agent. HPVs are DNA viruses that are typed based on their DNA sequence and further subgrouped into high and low oncogenic risk. High oncogenic risk HPVs are considered to be single most important factor in cervical oncogenesis. So, pathogenesis of cervical cancer is high oncogenic risk HPV. High oncogenic risk HPVs have also been detected in vaginal squamous cell carcinoma and in subset of vulvar, penile, anal, tonsillar and other oropharyngeal carcinomas. Low oncogenic risk HPVs are cause of sexually transmitted vulvar, perineal and perianal condyloma acuminatum. So, low risk HPVs are the causative agent of condyloma acuminatum, sexually transmitted condyloma acuminatum. And the high risk HPVs are HPV 16 and 18. HPV 16 alone accounts for 60% of cervical cancer cases, while HPV 18 accounts for another 10% of cases. Other HPV types contribute less than 5% of cases. So, HPV 16 is most important causative agent of cervical cancer. Risk factors for cervical cancer. They are related to both host and viral characteristics such as HPV exposure, viral oncogenicity, inefficiency of immune response of host, and presence of co-carcinogens. So the factors involved are multiple sexual partners, male partner with multiple previous or current sexual partners, young age at first intercourse, high parity, persistent infection with high oncogenic risk HPV, that is 16 and 18, immunosuppression, certain HLA subtypes, use of oral contraceptives, and nicotine use. Human papilloma virus, it infects immature basal cells of the squamous epithelium in areas of epithelial breaks or immature metaplastic squamous cells at squamocolumnar junction. So, HPV infect the immature basal cells. Virus can infect only the immature squamous cells, but their replication occurs in maturing squamous cells, leading to coilocytic atypia, a cytopathic effect known as coilocytic atypia, characteristic of HPV infection, which is characterized by nuclear atypia and a cytoplasmic perinuclear halo. Means nucleus is atypical, reniform shape with a halo, cytoplasmic perinuclear halo. Classification systems for premalignant squamous cervical lesions. The premalignant cervical lesions are known as cervical intraepithelial neoplasia. Currently, it is known as squamous intraepithelial lesion. Previously, the term was cervical intraepithelial neoplasia, now squamous intraepithelial lesion. CIN, cervical intraepithelial neoplasia, is of three types: type 1, 2, and type 3. Type 1 includes mild dysplasia of the epithelium, 2 moderate dysplasia, CIN 3 is severe dysplasia and carcinoma in situ. In current classification, squamous intraepithelial lesion or SIL, CIN 1 is included in low grade SIL. SIL is further categorized as low grade LSIL or high grade HSIL. Low grade and high grade. Low grade include CIN 1, CIN 2 and 3 are high grade. High grade SIL. Grading of SIL into low and high grade is based on expansion of immature cell layer from its normal basal location. If atypical cells are confined to lower one-third of epithelium, it is L-cell. And if it expands to two-thirds of epithelial thickness, it is H-cell. If confined to lower one-third, then L-cell, or two-thirds of epithelial thickness, it is H-cell. So this micro photograph is depicting CIN 1, 2 and 3. L-cell and H-cell. If lower one-third show atypical cells or dysplastic cells, mild dysplasia, lower one-third is involved. If two-thirds is involved, moderate. If full thickness is involved, then severe dysplasia or CIN 3. 2 and 3 are high grade cell, H cell, and 1 is L cell. About 60% of L cell, they regress to normal and 10% will progress to H cell. 10% of H cell will lead to carcinoma, cervical carcinoma. Coming to cervical carcinoma. So the risk factors involved in cervical carcinomas are human papilloma viruses, and the list we have already discussed. Squamous cell carcinoma is the most common histologic subtype of cervical cancer. So approximately 80% of cases of cervical carcinomas are squamous cell carcinomas. About 15% of cervical cancer cases are adenocarcinomas. Adenosquamous and neuroendocrine carcinomas are rare cervical tumors that account for remaining 5% of the cases. So 80% cases are squamous cell carcinomas, then adenocarcinomas, and few cases adenosquamous and neuroendocrine carcinomas. So in cervical pathology, you will get note on premalignant conditions and cervical carcinoma. Thank you.